This was a great segue to what we're going to talk about, and it's great to see a company with the magnitude of Asahi now dedicating, they've got a tremendous reputation in the coronary space, now dedicating certain wire lines to the peripheral space, which again, whoever's going to make my life easier in crossing a lesion, I will be forever in debt for him. All right, so really, if you can't get there, then you can't do anything. And that's what we sometimes overestimate, is we always focus on the lesion and crossing the lesion. Sometimes we underestimate how we're going to get there. And this is where I believe this CrossLead Pro 035, with the characteristics that Chairman Miyata just discussed, which is the torqueability, the trackability, the fact that you can deliver equipment over, is extremely important. So the Act 1, as we said, it's the torque force, it's the narrow loop crossing, it's the smooth maneuverability. There's no shame in saying this, but I was 100% Terumo Advantage 035 wire user, just because it's an exceptional wire at that time, until this young man, Sergio Valli, who is currently with Asahi, who used to work with me in the past. He's like, hey, can you try this? I'm like, Sergio, stop wasting my time. He's like, just try it. And I hate to say, but in our lab, it's called the surge wire. I'm sure Asahi is very proud to hear that. But no, seriously, that is what a trusted partner is like, hey, I know your style of how you do things. Just give this a try and see. Chairman Miyata went over most of this, but it's a very versatile wire in getting to where you need to go. When it comes to contralateral access, for example, navigating unfavorable anatomy, going through stents, and just that cross loop that you can cross and maintain a safety profile that you're not going to perforate. Those are things that to us as proceduralists is very important. Now, based on your familiarity with this wire, and of course there's a learning curve, similar to any other device that we use, straight crossing, narrow loop crossing, subintimal crossing, or instant crossing. And hopefully some of these images that we'll go over will show this. But this is not my slide. This is a CTO, an osteal left common iliac CTO. This is exactly what this wire will do. It will engage, and then with just a little bit of pushability, you can see it flying through that lesion. So this whole CTO crossing took less than 45 seconds. That's pretty much the difference between this patient having a successful endovascular procedure versus much more complex surgical revascularization. Obviously, the narrow loop crossing, which is extremely important. On the top, we can see the CrossLead Pro versus its competitor at the bottom, and this competitor is the Terumo Advantage. And that tight cross loop is extremely important to what we use. Just for the sake of time, we're going to just go through this a little bit faster. So in-stent crossing, as we can see, once you get through the stent, you have that nice knuckle. You can advance easily without being concerned about going out of the stent struts. But more importantly, when you're dealing with a native vessel, you don't want to keep on going with the side branches, especially with an 035 vessel. 035 wire profile. These are just a few examples. This is coming from below in a retrograde access, crossing a subtotal calcified SFA. Takes a few seconds. This is coming in an antegrade access, crossing a CTO from an up and over. And we see it very easily. You're in control. You're in control of the wire does not control you. There are some wires where you're like, I don't know where this goes. This wire, you're in complete control. You can advance it, you can loop it, you can torque it. But more importantly, even when you cross, you can exchange it, right? Because sometimes you can get that 035 wire down, but you can't cross anything over it to exchange to an 014 or an 035 system. This is a subtotal left common iliac artery calcified lesion. As we can see, it negotiates it from a radial access. This procedure took less than 20 minutes, based on the fact that we were able to get this safely through the lesion, and then you exchange over whatever wire you want, and then you can work from there. This is obviously going through a multi-level occlusions coming from the radial approach, and as we can see, external iliac, common femoral, SFA, and even in the popliteal from a radial approach, and this is not even with a support catheter. Left SFA crossing via radial access again, very simple to go. Most of these, sitting next to Sergio is my main scrub person, Peyton Meeker, who did most of these cases with me. This is navigating a radial loop, which is sometimes we see can be a big problem. Instead of changing your access point, if you're using the right wire, you can get through it in a very short period of time. We do obviously a lot of radial to peripheral. This wire, even in a hostile type 3 arch, you can navigate through it very easily and with massive control. As we do more and more venous procedures, we are utilizing this wire more and more, from the up and over techniques, getting into either for DVT cases or even just doing iliac compression cases. Same thing, the wire navigates very easily through these stubborn anatomy. When we're dealing with acute on chronic DVT crossing, this wire tracks very easily into the IVC, which we can exchange with a crosswalk, an 035 crosswalk, which I think the next series will show it, is that you can take then your stiff Amplatz wire and do whatever you need to do. This is an acute on chronic case, just recently, an 84-year-old. This is what we started off with. This is actually Peyton was doing this case, and as we can see, the wire flying up in the superficial femoral and common femoral vein, and even when it comes into the pelvic vein segment, still tracked very nicely. And then this here is the crosswalk, tracking over that same wire, going into the IVC. Once you get into the IVC and you get that Amplatz up, you can do a lot of different things, and this is the end result. So in summary, this wire is extremely versatile, extremely helpful to get where you need to go, and has pretty much changed my treatment algorithm when it comes to not only getting to where we need, but also crossing and treating. Thank you very much.
Thank you, Osama.